All right. Hello, everyone. I'm just waiting for people to pop into this session. Welcome to panel number 3, Advocacy for Change. We're so delighted you guys could join us today. My name is Kimberly Hickey, and I'll be moderating the panel as a volunteer for Emotions Matter. While doing the introductions, we invite you to write in the chat where you're joining from us today.
Hi, my name is Audrey. I'm a volunteer from Wisconsin. I volunteer for Emotions Matters Advocacy Committee, and I have lived experience with BPD.
Hi, my name is Lara. I'm a volunteer from Chicago, Illinois. I volunteer for the Advocacy Committee, and I also have lived experience with BPD.
Hi, my name is Marsha McAdam. I'm based here in the UK, and I identify as someone who has a diagnosis of borderline personality disorder.
Awesome. Thanks so much, guys, for sharing. So we're going to get into some questions for our panelists. So first, tell us a little bit about yourself and your BPD journey in connection to BPD.
So once again, I'm Audrey. I'm currently a sophomore at the University of Wisconsin-Madison, and I'm studying nonprofit work. I really hope to go into the mental health care sector when I graduate. In regards to my BPD journey, I feel like I've exhibited the symptoms of BPD from a really young age, but I wasn't officially diagnosed until my freshman year of college at the age of 19. For me, my diagnosis was a really lengthy and frustrating process. If anyone wants to talk about it, drop a question in the chat. But currently, I'm really at peace with my diagnosis. I think that that label has made me forgive myself for a lot of the maladaptive coping skills that I would partake in when I wasn't receiving the right treatment. So now I get to give back and volunteer for Emotions Matter. So thank you, everyone, for being here.
I graduated from college a couple of years ago. I'm currently working. I was diagnosed with BPD at 20, but was faced with a lot of stigma. So I kind of avoided the diagnosis because I didn't fit this stigmatized version of what doctors and psychologists were saying that BPD patients were like. So I kind of thought that's not my diagnosis. But then my borderline traits just became more apparent and my life-threatening behaviors increased. And I finally had to accept the diagnosis. If anyone wants to talk more about it, I'm here about fighting the stigma. But yeah, I currently in recovery and I'm happy to volunteer with the Advocacy Committee and tell other people my story so that it might help them.
So I'm in my late 40s, and BPD robbed me of my 20s and my 30s, and it robbed my son of his childhood, because he was the carer of 10 to 18. And it was after one too many overdoses that I was in a near fatal overdose that saw me in an induced coma for 3 weeks. And then it was only then that services started taking me seriously. Before that, I was seen as manipulative, attention-seeking. When I got the diagnosis, it suddenly made me think, I'm not evil. I'm not evil. It made sense. And then after that overdose, I then was referred to mentalization-based therapy, which saved me from myself. And I see myself as recovering.
Awesome. So why did you guys get involved in advocacy?
So for me, when I was getting assessed for BPD, my psychiatrist was the one who suggested that I do some research on BPD online just by doing some quick Google searches to see if it resonated with me. I was quick to find out that, who Google thought I was and who it painted people with BPD to be was extremely stigmatizing and harmful. And frankly, it just sent me kind of into a downward spiral on my own self-image to see this is how people viewed me. So a lot of my advocacy work has to do with online resources and destigmatizing things like that. And I would say that, as I was reading that, I felt very triggering to me, and I just don't want anyone else to ever go through that, especially when you're getting diagnosed. All you deserve is help and to get the right treatment that you need. So I joined Emotions Matters Advocacy Committee and started to do some fact checking and accuracy checking on online resources for my advocacy.
I really always loved like politics and public policy and was really always interested in healthcare. And when I got diagnosed with BPD, similar to Audrey, I faced a lot of stigma, and I've noticed that a lot of, public officials also stigmatize the disorder. So I took it upon myself to kind of like talk to politicians about BPD and what it really is, for the purpose of bringing more access to care for people with BPD, because in Chicago, I pay probably like thousands of dollars out of pocket for DBT. And I think that's really unfair. And that there are a lot of people who can't afford that. And also I think by destigmatizing it, we could like make the solution a little bit more apparent.
So here in the UK, it's only in the last few years really where you learned that actually there was talking therapies for BPD. And when I was at my illest, I admit I was an utter nightmare, but it was because I was in so much pain and it was the only thing that I could control. However, the experiences that I received from mental health professionals was so appalling, and that hurt. I don't want other people to go through that. And so when I started using my voice, I'm now doing things that I never ever thought possible, but it's so that people can see that I'm not my BPD, I'm so much more than my BPD.
Society, organizational systems, or government?
I primarily wanted to change society's perceptions about borderline personality disorder through editing online resources. I think that society's perception of BPD is stemming a lot from ignorance and misinformation that just reiterates those old ways of thinking that continue to perpetuate stigma. So I think that if we continue to speak up, especially those of us with lived experience or those of us who have a loved one with BPD, we can start to control the narrative about us so that it's not so negative and so that it's not being written by people who think negatively about us, but people with lived experience and people who really understand it.
I really wanted to change the government's opinion of BPD. When I went to residential about a couple years ago, I realized that some of the services that were being offered by Medicaid and like public health services weren't exactly sufficient enough to treat BPD. So I really wanted to bring DBT to the awareness of like public officials and to tell them that this is not only something that could save lives and help people with BPD, but can reduce homelessness rates and incarceration rates, and inpatient psychiatric rates. So I think really educating the government about like what DBT is and how it could help people really helped me.
So while we have NHS here in the UK, sadly, sometimes it's a postcard lottery about where you can get support, or sometimes you're deemed too complex or not complex enough. And sadly, people die because of the diagnosis. And I used to go to conferences and always was asking questions. And then I'm now linked in with the NHS and the wider mental health community here in the UK. But one of the people I asked a question to then turned out to be the founder of mentalization-based therapy. And for the last few years, we've partnered up in trying to do something to address the stigma together, as me, the expert by experience, and him, the expert by occupation, and trying to bring people together to really get people to see that, instead of seeing all the chaos in front of them, to see the pain that we go through. And that, so yeah, it's pretty tiring, but it helps so many people, I feel.
Yeah. Can you tell us about your specific advocacy initiatives? And I'm just going to share my screen for this.
Okay, so my specific advocacy initiative started with the Department of Health Services in Wisconsin. When I was going through fact checking of different online resources, especially health organizations, I found that the health department services in my state of Wisconsin had a huge gap in their information. It was outdated, it was stigmatizing. So knowing that, I was able to do some research on their website and found out that they had an mental health council that met bi-monthly. And I was able to contact someone on that council and get a meeting with them so that I could speak during public comments. So I ended up going to their meeting and expressing my experience as someone with lived experience in Wisconsin and how important and life-saving these resources really are for people with borderline personality disorder, especially with a new diagnosis. It was really well received. We got a lot of contact information. So that was great. And then just kind of moving on, my second initiative was with Mental Health America. So originally I had noticed that their Wisconsin chapter's website had written that, people with BPD might use self-harm or suicidality as a form of manipulation, which is not true. So I was able to connect with the website curator for MHA Wisconsin, was the national website, sorry. And she actually was able to contact the Wisconsin chapter and she got them to take it down, which was great. And then once I was in touch with the national branch, I was also able to take a look at the national website and give Kristen my notes. So here are a couple examples here on the slide. So for symptoms, originally they had compared BPD to other personality disorders, and you can see they're all defined by very negative adjectives like lacking in empathy, constantly demanding special favors, deceitful, emotionally shallow. So immediately I told her to take that down. And then I was able to kind of get her to refer more to the DSM-5 and have those kind of symptoms rather than kind of making comparisons that were unnecessary. And then if you could click on the next slide, Kimberly, thank you. So this one was about treatment options. So before they had said that BPD was primarily treated with DBT, and while DBT is great, it's not the only option. And I think that it's really important to let people know that there's mentalization and schema therapy and other things that they can access so that they're not kind of trying to find one thing. So those are kind of my initiatives right now.
Okay, yeah, so this is just a little bit about me. I'm 24, I live in LaGrange, Illinois. Okay, advocacy efforts. So with Kimberly and Paula, I got a House Joint Resolution to declare May BPD month in Illinois. A resolution is basically like a statement of intent by the Illinois House of Representatives. So it's not like a piece of legislation or a bill, but it's just something that brings more awareness to state government. And Kimberly and I testified last week at the Mental Health and Addiction Committee hearing, just sharing my story about BPD and some facts about BPD to legislators so that we could bring more awareness to the issues in Illinois. State Representative Lindsay LaPointe, who is the chair of the Mental Health and Addiction Committee, has really been our champion. She said she didn't know a lot about BPD in the past. She stigmatized it, and she's really happy that we're bringing more awareness to it. And with this awareness, we're hoping it could be a stepping stone into possibly getting more access to DBT by increasing Medicaid reimbursement rates. Some of the obstacles and challenges include opening up about my own story. It was really emotional in front of politicians. Being vulnerable with them was really a challenge, but I think it worked out in the end because they all said that it really helped to see someone in recovery and to know that DBT could work for people.
So, so for me, I was co-chair of a Greater Manchester personality disorder strategy that saw the 3 mental health trusts here together and lived experience people coming up with a strategy that is then going to be adopted across the footprint. And then just as COVID started, I partnered up with Professor Peter Fonagy, who's Chief Exec of the Anna Freud Centre, and Sarah Hughes, who was Chief Exec of the Centre for Mental Health. And we brought a series of stakeholders together in round tables to acknowledging that we understand there's 2 sides. There's the side of people like myself who identify with the diagnosis because that meant that I got that life-changing therapy. But then there's also the other side that people are completely anti the construct and get harmed, whereas we wanted to get together and do something in the middle, which was forget what it's called. People are being hurt, and I got MBT, I got help, why can't they? And then Peter sent me a email with this Emotions Matter and BPD Fest a few years ago. And I was like, wow, oh my God. And sadly, when I tried to join it, I was in a crisis point, I was poorly. But then I used what you did here to bring together people from right across the sector here in the UK, using art, poetry, and photography for the Awareness Month, using the theme of young people, early intervention and prevention. And then I managed to get Manchester Cathedral to host a finale celebration on the 31st of May, where we got the key stakeholders that would usually be the professors in that, as you know, usually plenary speakers. We invited them to be VIP keynote listeners. And from then, so many things have all of a sudden started happening in that. And I feel like pinching myself in that because it's just unbelievable what's happening in that. But it's trying to bring everyone together. And to me, it's not just the mental health professionals that need to discuss this. We need a wider community to try and improve things, because sadly, people with this diagnosis there's injustices and so many inequalities as well. There's so much to do, but we're in awe of you.
Thank you. All right. So I know, Lara, you touched a little bit on this, but what obstacles or challenges did you face in your advocacy efforts?
The biggest challenge for me was definitely not knowing who to contact and not really having a big network base starting out. I'm a college student, my friends are 20, they're not running health organizations, they don't have those kind of like that reach. So I think kind of learning how to navigate that and think of creative ways to kind of get in touch with people and like make an impact where they would respond and work with me as a stranger was definitely something that was challenging for me.
Like I said, being vulnerable was really challenging. It took a lot of inner reflection and self-work. But also just, I know we had a lot of trouble we didn't really know that much about the legislative process. So when the resolution was getting passed, we didn't know like if it should go through the House or the Senate. And we didn't know like when the right time to pass it was, because we don't have experience in politics. So we needed to contact a lobbyist so she could help us with the political side of things. So that was really stressful, but we got it done.
So with me, having so many overdoses, I'm now, I have domiciliary care, carers that help me with my personal care and medication and that. And I use a mobility scooter to get out and about as independence. So I'm on state benefits. So everything I do is voluntary. But for the first time in my life, I've actually got purpose. But the stuff that we've done is just on people's goodwill. And for me, there needs to be some funding somewhere. I wanted to get a cathedral for this year to do the tale of however many cities that we did last year. I wanted London Cathedral. I couldn't get it. I got Manchester free. And then it's also, there's a really high percentage of people here in the UK that are completely anti the construct. And we've gone from changing the name from borderline personality disorder to emotional unstable personality disorder to now complex emotional or relational needs. And you need to have a diagnosis to get the therapy, the money to be paid and that. So sometimes it's really tiring. But yeah, what I try to do is bring a safe space together to get everyone around the table and forget egos and that everyone in there together is trying to do something. And I'm not educational at all. I'm a feeler, a networker in that. And I've done so much through virtual meetings. So yeah.
All right. How did others respond to your advocacy efforts?
So I think that, being honest, I was expecting people to respond negatively just because I assumed that if they were upholding this information on their websites, then I automatically assumed that must be how they felt about me. So I definitely had my guard up when I was coming, and I made sure to kind of tell them how it affected me. But I really think that a lot of people just weren't aware, and I think that they hadn't spoken to a lot of people with lived experience with borderline personality disorder. And it wasn't until I brought it to their attention that they were like, oh, we didn't even realize how this was affecting you. We didn't realize that it was outdated, because they just weren't aware. So I think that everyone responded really positively when I mentioned things. So I thought that was great, and it encouraged me to keep doing advocacy. So
yeah, the response we got was great. A lot of the people we talked to said that they previously stigmatized BPD, and they were glad that we kind of destigmatized it for them. In the hearing that Kimberly and I testified at, we had a politician say that he had a family member that's been in and out of inpatient, and so our stories really resonated with him. And yeah, I think I was expecting people like there to be a little bit more pushback, but I think at the end of the day, sometimes politicians are listening to like really arcane and like dry stuff. So they were happy to hear something that like really moving stories.
The negative bit is something that I mentioned before about some people are completely anti the construct. And then also because I'm sitting around the table with the mental health professionals and that, sometimes I may be accused of being a sellout. Does that sound, like as a service user representative in that? And it can be tough at times. Yeah.
All right. What are your hopes about the outcome?
So for me, I hope that like with MHA especially, that we're able to kind of build those relationships and partnerships with organizations that maybe we previously hadn't had any contact with. So kind of get our foot in the door to maybe work with them on other things in the future. I think in a broader sense, I really hope, again, to kind of change that narrative that has been circulating around BPD so that when people look up borderline personality disorder, they don't see manipulative or crazy. They say strong, resilient, and like most of all, that we're treatable and that we're the most empathetic people around. So that's my goal through all of this.
My goal, I'd say overall, is to bring DBT to people who need it, especially incarcerated people and the homeless population, low-income families. But like a broader goal would just be to destigmatize BPD in Illinois. I faced a lot of stigma from providers, and I think with this like awareness campaign we've been doing, hopefully it can teach people to be less stigmatized in their views about BPD.
So I'm involved nationally with various organizations, and it's about them all working together to try and do things differently. And when I did this Tale of Three Cities, I got the Royal College of Psychiatry. There was so many people, so many organizations that were involved in that Tale of Three Cities, that were involved in criminalizing distress webinars, BPD and other comorbidities webinars. There were so many things throughout last year, month of May. And so this year I'm concentrating on policy, and there's ISSPD recently recruited consumer carers, and I'm on the subcommittee of that. And in the future, I'd love to go and visit Origin in Melbourne to look at their young people's early intervention and that. And then it would be my dream to go to Houston and spend some time with Carla Sharp and look at mentalization-based therapy, how she's adapted it for adolescents, and then bring the learning back here, because the brick wall that we've hit, we need to do things differently.
Yeah. And lastly, what advice do you have for someone who wants to get involved in advocacy in their own community?
I say go for it, but definitely pace yourself. I know for me, I definitely get really passionate about things, and then I try to do everything all at once, and then that can kind of lead to burnout. I think, especially with advocacy, you can unfortunately deal with a lot of rejection. So I think just kind of pacing yourself and thinking, okay, what's one thing that I can do this week, and making sure that you're keeping track of everything. But I say do it. I think that any little bit helps, and we'd love the help. So
I agree with Audrey. Just go for it. Utilize your personal connections, whether it's doctors, teachers, people in the political field. Utilize those connections to make the kinds of changes that you're hoping to see, and find out what works for you. I mean, I really like politics, but Audrey's like all about the website and societal change. So find like your niche that works for you.
I would encourage people to go and mentor. So Lara, I would encourage you to go and ask to shadow a politician or that. I've done it here, and they get to understand your thinking, and then you can sort of help inform some of theirs. Be kind to yourself, and like with me, I now have expert by experience myself and the experts by occupation together with the same aim, and now I feel like I've got colleagues around me, and that which is some surreal, because in the past I had nothing and I'm a bit of a recluse at home. So yeah, just be kind to yourself.
Great. All right. So for our Q&A session, we have a bunch of questions. Two questions in particular. How can we get involved in New York, Long Island specifically? And specifically to Lara, how can Chicago area people get involved?
I would say, yeah, is it okay if I like put my contact information?
Yeah, for sure.
Okay. Just put it right here. I'll put my email and my phone number, and we haven't really come up with like a plan yet about how we want to implement this awareness campaign for the resolution. But when we decide that, we'll definitely need more people to get involved and write to their legislators. And we're going back down to Springfield in the fall to testify in front of the Senate. So we might need some people to help out there. But there's definitely like research that we need help with, and interactions with politicians that we need help with. So I'll put my name and email.
Thank you.
Can I just add something?
Yeah.
Lara, what you need is to be able to really network and that. And I have a mobility scooter, and I joke if there's someone in the way, I just go around it. And that, yeah, it's tiring, but yeah.
Yeah, and How can someone who maybe lives in Long Island specifically, how can they get involved in advocacy?
I would say contact Paula. I'm not really sure, like, if we have any campaigns in Long Island at this moment, but I know Paula's always doing like BPD open mic nights and BPD Fest and like different events that you guys could go to. And there might be some opportunity to help out with like other campaigns across the country. So I think on Emotions Matters website, there's like an advocacy tab and you could fill out your name and your information. So I would just go there to get started.
Yeah. We have another question. Did any of you in the USA contact NAMI?
Yeah, we contacted NAMI for the resolution. We only contacted their Illinois chapter, but we got them to support our resolution, and hopefully we'll continue to work with them in the future.
All right, this is a little bit of a long question. This is such a great point about how anti-construct movements, such as those asking for a relabeling of BPD, can challenge advocacy efforts. I'm curious if others have encountered this also, including people preferring to understand it through the CPTSD label or other labels. Does this challenge your own self-understanding? Do you see the people you are lobbying with, such as politicians and care providers, also taking this perspective about the construct of BPD?
Can you repeat that? Sorry.
Yeah. So she said, this is such a great point about how anti construct movements, such as those asking for a relabeling of BPD, can challenge advocacy efforts. I'm curious if others have encountered this also, including people preferring to understanding through the CPTSD label or other labels. Does this challenge your own self understanding? Do you see the people you are lobbying with, such as politicians and care providers, also taking this perspective about the construct of BPD?
Yeah, they do here in the UK. There's quite a lot of groups looking into that and about the harm that's been done. There's some groups with the Royal College of Psychiatry. There's the experts by experience and coming together and really looking at that. My worry is, I completely get it, but if we would have to have kind, empathetic mental health professionals that could see us in the pain, and if they could stop some chaos with their empathy in that. And so to me, that's what I would like, Yeah. Does that make sense?
And this is a question for Marsha specifically. Why do you think the UK and the US are so different in their approaches with BPD/EUPD/ whatever you want to call it?
I really don't know, and that's what I want to find out. I would love to come and visit. If I'm successful in going to Houston, I'm going to try and swing by New York to spend some time with yous. Because look, you're doing your run, you're doing your comedy nights and everything, and I'm seriously in awe of everything that you're doing. I'm not just saying it. And I looked at what yous were doing and tried to do that here in the UK, using the art, poetry, and that to bring to life. For me, that's it.
And there's one more comment. It would be great if you could get the royals like Kate and William to make a public statement of support. I'm wondering how you guys feel about that.
I don't know. I really don't know.
All right. If there's any more questions, you guys can just type it in the chat or the Q&A chat.
So just that would be wow, wouldn't it?
Yeah.
But this year, there's the NHS Confederation that I'm part of.
Mm-hmm.
There was a mental health network conference. Myself and Peter Funegate had a presentation in conversation with, and we talked about some of this stuff. And then in a few weeks' time, UCL, University College London, are having a conference because this year it's the 20th anniversary of something called personality disorder, no longer a diagnosis of exclusion. So we're actually seeing what has changed over the last few years. And then myself, Peter Funegate, and the president of the Royal College of Psychiatry are doing a presentation at their international congress to talk about what has changed. And the president of the Royal College was someone that worked with me earlier last year on the Criminalising Distress webinar. And he himself is one that's funded this work to look at a diagnosis and, the harm. And then in September, the NHS Confed are holding a webinar with members to look at all the policy things that have happened throughout the year and then do something with it. So we are doing something, and that.
Yeah. Audrey, Lara, do you guys have any last minute, maybe what are the future steps in your advocacy efforts?
Yeah, so I think that Kimberly and Lara have actually been helping me to kind of delve deeper into the MHA website. And I think Kimberly said it really well, is that even though it's better, we deserve for it to be zero stigma. So right now we're kind of hoping to contact someone else who can maybe we can meet with them over Zoom or in person to kind of talk about how we can make it no stigma and not settling for better, because I think that we deserve to have it all be right.
Absolutely.
Yeah, I'm really hoping, like, now that May is BPD month in Illinois, to create more like awareness activities in Illinois, or to create like a broader awareness campaign about that. And also, I just really want to tackle the Medicaid issue and get, full DBT with the phone coaching and skills group covered under Medicaid. Sorry, my cat is like here. But yeah, those would be my next steps.
Okay. And I have another question. So it's for Marsha. So cool that you work with Funagi. Here in Montana, we are trying to implement MBT in our behavioral health department. So I'm curious, what is he like in person?
He's real and he gives a damn. And he actually talks about his own lived experience as a teenager, and when he then went and got help from the Anna Freud Center, which he's now the chief exec of. And he's really, really down to earth. And I was approached recently. They're looking to update mentalization-based therapy resources and look at co-producing it and also co-delivering the training in the future. And when I see just how MBT started, and now it's eating disorders, it's they're doing it around complex trauma, adolescence, it's like, wow. And so at times it does feel sort of surreal. That person is, but yeah, he is so nice. And I take my hat off to him.
All right. Well, on behalf of Emotions Matter, I want to thank the panelists for sharing and for this insightful discussion. And thank you to the attendees for the questions. If you have any more questions, you can always you can connect with the presenters in the people profiles engage button on the left-hand side of the panel, or email info@emotionsmatterbpd.org. And there are resources which are downloadable links related to this topic at the end of the screen. So I'm just going to share my screen one more time. All right. And we invite you to make a donation to support Emotions Matter for BPD Awareness Month. Additionally, come to the Walk for BPD on Sunday, June 4th in New York City. Walk virtually and follow our Facebook Live feed. And there's more information about how you can get involved. All right. Well, thank you so much, everybody.
Thank you.
Thank you, everyone.